Hi, I'm Aparna Parikh. I'm a gastrointestinal oncologist at the Massachusetts General Hospital and also faculty in the Tumor Center for Targeted Therapy. Today I gave a brief talk on the clinical applications of liquid biopsies, also known as circulating tumor DNA in gastrointestinal malignancies. I touched on a couple of different points. I talked about how liquid biopsies could be used in the setting of drug resistance. What we've learned is that tumor biopsies grossly underrepresent the heterogeneity of cancers and drug resistance, and liquid biopsies actually may be able to capture that heterogeneity better than tumor biopsies. This was work that was recently highlighted in our Nature Medicine paper, which I discussed today, that was published in September of 2019, showing that liquid biopsies found more resistance alterations than matched tissue at the same time. Secondly, I touched on the use of liquid biopsies and the ability of liquid biopsies to actually predict a therapeutic response and show that we can look at circulating tumor DNA in the blood as early as 4 weeks and get a sense of whether a patient is benefiting from therapy or not. Finally, I touched on residual disease and the fact that detection of circulating tumor DNA after curative intent surgeries, particularly in colorectal cancer, is predictive of recurrence at a pretty high rate. What we also have shown now is that chemotherapy can actually impact and clear that cell-free DNA. And further clinical trials are underway looking at additional therapy to clear ctDNA in order to impact long-term outcomes, particularly recurrence-free survival and hopefully overall survival for patients with colorectal cancer.